5 subtle clues. Your mouth is heading toward a dangerous infection. Is your body warning you? Through your mouth, infection usually enters your body through a microscopic crack in your gums or teeth. Once it's inside, it quickly travels along the jawbone or through your sinuses to the brain. It can even jump into your bloodstream and travel to any organ in your body, causing an abscess, endocarditis, meningitis, or sepsis. And this happens every single day because people ignore these 5 clues. No. 1. Jaw stiffness or tenderness. Picture this. You wake up and your jaw feels stiff like you had an intense workout yesterday. You might think, it's just a crick in my neck. Must have slept wrong again. But here's the thing. Jaw pain or stiffness could be your body's way of saying, hey, there's an infection brewing beneath the surface, especially if you notice tenderness around your molars near the back of your mouth. Now, molar infections are no joke. They can spread to your sinuses, even your brain. So don't just blame it on sleeping funny. If your jaw hurts, it's trying to tell you something important. Number 2. One tooth more sensitive than the rest. Imagine you're sipping a nice cup of coffee when suddenly one tooth feels extremely sensitive to the temperature. This doesn't mean you have a cavity. Most sensitivity comes from inflammation, and inflammation means infection. Think about it. When bacteria build up under your gums or near a tooth, it creates an inflammatory response. That's why your tooth feels so sensitive to hot or cold. In fact, research shows that almost 70% of tooth sensitivity cases are linked to some type of infection. Ignoring this clue is like ignoring a smoke alarm. You need to investigate further because it could lead to something bigger. Number 3. Mild pain when chewing hard food. Picture this. You're biting into an apple when you feel a twinge of pain or discomfort in a specific area of your mouth. At first, it's just a mild annoyance, but it keeps coming back when you eat certain foods. If you've brushed off this symptom as just a little sensitivity, think again. Research shows that persistent pain when chewing hard foods could be your body's red flag indicating a deeper issue like an abscess or advanced decay under a filling. Left untreated, these problems can lead to severe infections. It's not just about toothaches. The pain could also signal issues with your gums or jawbone. Ignoring these early signs can make a small problem into a big one. So pay attention to what your mouth is telling you. Number 4. A gum pocket feels deeper than others. When you look at your gums, do you notice one pocket that seems deeper than the others? Maybe it's right next to a back molar where you can't see very well. Or maybe you only notice it when you run your finger along your gums. Here's the deal. Your gums shouldn't have any deep pockets. If they do, it's a sign of gum disease, which is basically a gateway to all sorts of trouble. When left unchecked, gum disease can lead to things like abscesses, tooth loss, and even infections in other parts of your body. And here's why. As plaque builds up under your gums, it forms these pockets that become home to more bacteria. The more bacteria, the higher the chances of infection. What's happening in those deep pockets is a ticking time bomb. And if you ignore this clue, you might just blow past your chance to stop an infection before it starts. Number 5. Feeling off or low energy without being sick. Have you ever noticed that you're feeling kind of tired or generally unwell, but you know you're not coming down with anything? Like there's no fever, cough, or sniffles? Well, that's a clue in itself. Feeling low energy could be your body's way of saying there's an infection somewhere brewing. Mouth infections are sneaky because they often fly under the radar, especially when they start out. You might not notice any obvious symptoms. There might not be any pain or swelling yet. But here's what you need to know. Infections, even the ones you can't see or feel, take energy. Your body has to put a lot of effort into fighting them off. So if you are feeling drained for no apparent reason, pay close attention to your mouth. It could be the first sign of trouble. Now that we've covered the 5 subtle clues, let's talk about how to spot the infection map. You see, once an infection starts, it doesn't stay put. It spreads. so understanding where it might go is crucial. Here's a quick breakdown. Number 1. Abscess. If the infection stays local, it could form an abscess. This is a collection of pus that forms in a pocket in your gums, teeth, or jawbone. It might cause a lot of pain and swelling, and if it's left untreated, the infection could spread to other parts of your mouth or even your body. Number 2. Endocarditis. This is an infection of the inner lining of your heart. It can happen when bacteria from your mouth gets into your bloodstream and makes its way to your heart. If you have pre-existing heart conditions or dental problems, you're at higher risk. Symptoms include fever, fatigue, and murmurs in your heart. 3. Meningitis. This is an infection of the membranes that surround your brain and spinal cord. It's rare but serious. If bacteria travels from your mouth to your brain through the bloodstream or by another route, it can cause meningitis. Symptoms include high fever, headache, and stiff neck. And number 4, sepsis. Now, this is a life-threatening condition that arises when your body's response to infection injures its own tissues and organs. It's essentially your body's overwhelming reaction to an infection. If not treated promptly, sepsis can lead to organ failure and death. Common signs include high fever, rapid heartbeat, and low blood pressure. Once you know the infection map, it's time to talk prevention. Here's the deal. Preventing infections is much easier than dealing with the consequences. So let's dive into how you can keep your mouth and body healthier. Number 1, oral hygiene. This is the first line of defense. You need to brush twice a day with fluoride toothpaste and floss daily. This helps remove plaque and bacteria that could lead to infection. Number 2, regular dental checkups. See your dentist for cleanings and exams at least twice a year. Early detection is key to preventing small issues from turning into big problems. Number 3, healthy diet. Limit sugary and processed foods. They feed the bacteria in your mouth that cause decay and gum disease. Instead, focus on nutrient-rich foods like fruits, vegetables, and lean proteins. Number 4, stay hydrated. Drinking water, especially fluoridated water, helps wash away food particles and bacteria. It also stimulates saliva production, which is your mouth's natural defense mechanism. And number 5, don't smoke. Smoking weakens your immune system, making you more susceptible to infections. It also increases your risk of gum disease and oral cancer. Here's the harsh truth. Ignoring subtle signs is how infections take control. You can't afford to be ignorant about your health. You must acknowledge these clues. Your body's language is clear. You can't afford to ignore it. Listen up. If you notice any of these 5 signs, don't hesitate. Contact your dentist immediately. Remember, knowledge is power. Stay sharp and take charge of your health. Your life depends on it. And if you want to dive deeper into this topic, check out this video on how to identify signs of infection in your body. Each sign is a clue leading you to a complete understanding of what's happening within. It's like having a personal health detective guiding you through the intricate world of your body's signals. Don't miss it.